So dynamic gait index. The objectives for today's topic is, by the end of this topic, audience will be able to understand what is dynamic gait index and its interpretation. Introduction. Dynamic gait index was developed as a clinical tool to assess gait, balance, and fall risk by Annie Shumway, Hook, and Martha Woolcott. It includes 8 items: walking on level surface, changing speeds, head turns in horizontal and vertical direction, walking and turning 180 degrees to stop, stepping over and around obstacle, and stair ascent and descent. Each item is scored on a scale of 0 to 3, with 3 indicating normal performance and 0 representing severe impairment. The best possible score on DGI is 24. So the intended population is those with poor balance and at risk of falling, such as elderly population, stroke, vestibular disorders, balance issues due to non-vestibular causes, and brain injuries. Now, what are the material needed? First is box, that is shoebox, 2 cones, stairs, 20 feet walkway, 15-inch wide. Completion time required is 15 minutes. So first is gate surface. So the after taking the consent of model, the image has been put. Firstly, the instruction that has been given is walk at normal speed from here to next mark, that is 20 feet. So the grading will be normal, walks 20 feet, no assistive devices, good speed, no evidence for imbalance, normal gait pattern. Mild impairment is walks 20 feet, uses assistive devices, slower speed, mild gait deviation, and moderate impairment is walk 20 feet, slow speed, abnormal gait pattern, evidence for imbalance, and 0 is severe impairment that cannot walk 20 feet without assistance, severe gait deviation or imbalances. Next component is change in gait speed. So as we can see in this image, the model is walking. In the second component, we have to ask the model to change in the gait speed. So the instruction that has been given is begin walking at your normal pace for 5 inch. When I tell you go, walk as fast as you can for 5 inch, and when I tell you slow, walk as slowly as you can for 5 feet. So the grading again is 3 is normal, that is able to smoothly change walking speed without loss of balance or gait deviation, shows a significant difference in walking speeds between normal, fast, and slow speeds. Second is mild impairment, is able to change speed but demonstrates mild gait deviation or not gait deviation, but unable to achieve a significant change in velocity or uses an assistive device. First is moderate impairment. It makes only minor adjustment to walking speed or accomplishes a change in speed with significant gait deviations, or changes speed but has significant gait deviation, or changes speed but loses balance but is able to recover and continue walking. While zero is severe impairment, that it cannot change speeds or loses balance and has to reach for wall or be caught. Next is gait with horizontal head tilt. So in this component, we have to instruct the individual with begin walking at your normal pace. When I tell you to look right, keep walking straight, but turn your head to right. Keep your looking to the right until I tell you look left. Then keep walking straight and turn your head to left. Keep your head to the left until I tell you look straight. Then keep walking straight but return your head to the center. The grading says 3 is normal, that is performed head turns smoothly with no change in speed or gait. Second is mild impairment. It performs head turns smoothly with slight change in gait velocity, that minor disruption to smooth gait path or uses walking head. First is moderate impairment, that performs head turns with moderate change in gait velocity, slow down, staggers but recovers, can continue to walk. 0 is severe impairment. Perform task with severe disruption of gait that stagger outside 15 feet path, loses balance and reaches for the wall. Fourth is gait with vertical head turn. So as you can see in this image, we have to instruct the individual with begin walking at your normal pace. When I tell you to look up, keep walking straight but tip your head up. Keep looking up until I tell you look down. Then keep walking straight and tip your head down. Keep your head down until I tell you look straight. Then keep walking straight but return your head to the center. Gradings is normal. Performs head turn smoothly with no change in gait. Second is mild impairment. Performs head turn smoothly with slight change in gait velocity. That minor disruption to smooth gait path or uses walking aid. First is moderate impairment in which the individual be able to perform head turn with moderate change in gait velocity, slows down, staggers, but recover can continue to walk. While zero is severe impairment in which the individual uh, performs task with severe disruption of gait that staggers outside 15 feet path, loses balance and looks for the support. Next is gait and pivot turn. In this, as you can see in this image, the individual has to begin walking at the normal pace, and when the instruction is given, turn and stop. Turn as quickly as you can to face the opposite direction and stop. While grading is in normal, that is 3, pivot turn safely within 3 seconds and stop quickly with no loss of balance. While 2 is mild impairment in which pivot turns safely in more than 3 seconds and stops with no loss of balance. While 1 is moderate impairment in which the individual has to turn slowly, requires verbal cueing, requires several small steps to catch balance following turn and stop. While 0 is severe impairment and cannot turn safely, requires assistance to turn and stop. Next is step or obstacle. While in this, the instruction that has been given is begin walking at your normal speed. When you come to the shoe box, step over it, not around it, and keep walking. While the grading is 3, that is normal. In this, the individual is able to step over the box without changing its speed, no evidence of imbalance. While 2 is mild impairment, is able to step over box but must show down and adjust steps to clear box safely. While 1 is moderate impairment, is able to step over box but must stop, then step over may require verbal cueing, while 0 is severe impairment in which the individual cannot perform without assistance. Next is step around the obstacle. In this, the instruction that has been given is begin walking at normal speed. When you come to the first cone, about 6 feet, walk around the right side of it. Then you come to the second cone and walk around it to the left. The grading is 3 is normal, that is the individual is able to walk around cones safely without changing its speed, no evidence of imbalance. Second is mild impairment, is able to step around both cones but must slow down and adjust steps to clear the cones. One is moderate impairment and is able to clear cones but must significantly slow speed to accomplish task or requires verbal cueing. While 0 is severe impairment in which the individual is unable to clear cones, walk into one or both cones, or requires physical assistance. Next is last component, that is steps, in which the instruction has been given is walk up these stairs as you would at home, that using the railing if necessary, at the top turn around and walk down. So the grading says 3 is normal, alternating fit, no rail. Second is mild impairment. Alternating fit, must use rail. Moderate impairment, too fit to a stair, must use rail. And zero is severe impairment in which cannot do safely. Last is scoring. So a 4-point ordinal scale ranging from 0 to 3. 0 indicates the normal level of function, while 3 the highest level of function. The total score is 24. The interpretation is less than 19 is predictive of falls in elderly, while more than 22 is safe ambulators. Thank you. I would like to express my gratitude to Manisha Sangvi ma'am and our principal Dr. Apurva Shimpi sir for giving me the opportunity. Thank you so much.